The situation in Kebbi, a neighboring state with Sokoto, is more preventive. The Kebbi state government says it has adopted measures to prevent the outbreak of the communicable and airborne diseases. The State Director of Public Health, Alhaji Kabiru Al-Hassan, says that the measures include the procurement of drugs and establishment of emergency response teams. Health experts say preparedness for meningitis epidemics is difficult as vaccines cannot be administered until the different forms of the bacterium spreading are known. Once the disease is contracted, it can be treated in its early stages with antibiotics.
Yes, the situation is currently under control because people are responding, calling in, bringing in patients early. Last night we had 14 admissions right before me, and by the following morning they are all seated up. People brought in convulsing, vomiting, unconscious, where by the morning they are all up and eating, and then some were discharged. The most important thing is early referral. Then the because treatment is there. The governor of Sokoto Sierra, Honorable Aminu Waziri Tambuwal, has made the Ministry of Health to procure enough medicaments and commodities to cover the whole state. And we are going on until we defeat this current scourge.
The current World Health Organization recommendation for outbreak control is to mass vaccinate every district that is in an epidemic phase, as well as those contagious districts that are in alert phase. It is estimated that a mass immunization campaign promptly implemented can avoid 70% of cases. The National Coordinator of the Center for Disease Control, Dr. Chikwe Ihekwazu, says the center is working with donor agencies and state governments to contain the spread of the deadly disease.
Now, the most affected states, Sokoto, Zamfara, Katsina, Kebbi, and Niger states, and we're working with the state governments to coordinate the response, as well as our sister agency, the National Primary Healthcare Development Agency, WHO, UNICEF, and several other partners, now all working together with ourselves at the Nigeria Center for Disease Control. 3-4 years ago, there was a big vaccination campaign. The predominant serotype at the time was meningitis A. Now that serotype has more or less been eliminated. Unfortunately, what we are seeing is a resurgence of a different serotype, serotype C, which hasn't previously been common in the environment. And this is the second year we're having large outbreaks of meningitis C. So it now means we really need to rethink our strategy. Unfortunately, the vaccines available for meningitis C are not commonly available, not commercially available for procurement. They're very limited global stock and are managed by WHO. So in this case, we've now made an application to WHO to enable us have vaccines to respond to this specific outbreak, while we look towards advocating for more supplies in subsequent years. We have taken delivery of 500,000 doses. This is being managed primarily by our sister agency, the National Primary Healthcare Development Agency, and we're starting a big campaign to vaccinate in Zamfara State from the 11th of April, while working together with Sokoto and Katsina states to start campaigns in their states.
Figures from the Nigeria Center for Disease Control indicate within the first and 10th week in 2017, over 700 cases of meningitis was recorded, with 21 of these cases confirmed in the laboratory. Sadly, 85 deaths have occurred in 22 states, including Sokoto, Zamfara, and Katsina. This shows a significant increase in the number of cases and deaths in the same period in 2016.
So the WHO is actually not the only player in this, but they manage global vaccine stock. So once we have taken delivery of 500,000 doses. This is being managed primarily by our sister agency, the National Primary Healthcare Development Agency, and we're starting a big campaign to vaccinate in Zamfara State from the 11th of April, while working together with Sokoto and Katsina states to start campaigns in their states. But in addition, there are several other things we need to do. Firstly, we need to retrain our physicians in taking cerebrospinal fluid, which is needed for the diagnosis. We need to work with our partners to ensure that a test called Pasturex is available in all of these states. And we really need to inform members of the population to be aware of the symptoms of meningitis. It is primarily neck stiffness and increased sensitivity to light, and then fever, to really seek care very early, because there is treatment available, antibiotic, especially one called ceftriaxone, which really increases your chances of survival if taken early. So there's a lot of work being done. These are parts of the country, often very rural areas that is very difficult to reach and get communication across. So the state governments are really leading fairly aggressively in public enlightenment to the populations, and I really recommend the efforts both in Zamfara and in Sokoto that have been really proactive in responding to this.